Mrs. Knight. I have orders to put in a foley catheter for you. I understand that you haven't been able to go to the bathroom. You haven't been able to urinate in quite a while. Okay. Can you please verify your name and date of birth for me, please? Alright. I have Charlene J. Knight, date of birth 8/8/39. Alright, Mrs. Knight, is there any allergies I should be aware of? And I see here you have penicillin, latex, and betadine. Okay, I'm going to do a real quick assessment here. I'm going to first perform hand hygiene. Just want to assess the perineal area, make sure I don't need to do any care prior to the insertion of the catheter. I'm going to put on my non-sterile gloves. Alright, and I'm going to do a real quick assessment of the perineal area. And I do not see any visible soiling. I don't see any skin lesions, tears, any inflammation, anything like that, anything that's going to affect the insertion of the catheter. And I'm going to palpate the bladder, and I notice it is distended, and Miss Knight is clearly in discomfort as I'm palpating the bladder. So I can confirm that the catheter is needed, and at this time I can say with certainty I do not need to perform any perineal care, and I will cover her back up, take off my gloves, perform hand hygiene, and I would say, Mrs. Knight, I understand that you need a catheter. I'm going to go get that for you, and I'll be right back. Alright, and I am back. I have my catheter kit. I have a pair of sterile gloves, an extra pair of sterile gloves, and I noticed that this catheter is 14 French, which I can confirm with the provider's orders. And we are ready to insert the catheter. So I will lower the side rail, and I will get Mrs. Knight in position here. Going to put her leg out. Since I've been touching the patient, I will perform hand. And at this time, since I'm about to begin the sterile procedure, I will make sure that my bedside table is properly aligned to the right height, and I'll make sure that I am in a position to where I can always keep it in front of me at all times. Alright, we are ready to go. Going to save the plastic bag and use it as a trash bag. Going to do the outer flap, the side flaps, and during this entire process I'm making sure to only touch within the 1-inch borders at all times. Again, always making sure that I'm touching within the 1-inch borders, and that I am not reaching over my sterile field, and that my sterile field stays in front of me the whole course of the procedure. Okay, I'm going to apply the drape, so I'm going to pinch over the shiny portion. Again, making sure that I'm only within 1 inch. I'm going to take a step back, keeping the sterile field in front of me at all times. Shake open the drape, and with the shiny waterproof side down, I'm going to drape it in between Mrs. Knight's legs. Make some adjustments as necessary, as long as I stay in front of the sterile field, and if I touch within the 1-inch borders. And since I've been touching the patient, and haven't been using gloves, I'm going to do hand hygiene one more time. Going to remove the hand sanitizer from the table. And now I'm ready to don my sterile gloves. So I'm going to keep the sterile field in front of me. Make sure that I have enough room to open the gloves without having anything touch my catheter. Okay. since I just had my hand in the trash can, I'm actually going to do hand hygiene one more time, just to be extra cautious. Okay. Since I have opened up my sterile gloves, I'm making sure that my hands are within the 1-inch borders at all times, and that it does not drape over my catheter field. I'm going to pick up my dominant hand first, which is my left hand. Take a step back, making sure to only touch the cuff of the glove. Alright, and it is ready to go. Thumb out. It will scoop up underneath. Take a step back. My hand supinated. I will don my sterile gloves. So I am now sterile, making sure to keep my hands above my waist and below my head. And I am ready to perform the sterile procedure. So I will take my gloves that I do not need, and I will take my drape here. And since I am sterile, I can touch this drape anywhere that I want. Making sure at all times that I am facing my sterile field, I'm going to drape this drape over Mrs. Knight. Okay, and once it is draped, I cannot touch it. At this point, I'm going to make some adjustments here. Have my hydrogen peroxide, which I'm going to take a step back to open so that I avoid any splashing of substances over my sterile field, which would contaminate it. Drop that. And very carefully, going to pour hydrogen peroxide over the cotton swabs. Okay. Making sure that my hands stay within sterile range, I'm going to drop that. I'm going to get out my lubricant, taking a step back again to make sure that I do not have any liquids slosh onto my sterile field. Okay. Keeping my hands above waist level, I'm going to get rid of that. Going to exercise my plunger, making sure that it is working. And I'm going to take a step back again to make sure that I do not get any of this water should it shoot out on my sterile field. Okay, plunger is good. Again, making sure at all times that my body faces my sterile field and that I'm working within the 1-inch borders since I am sterile. Get rid of this. I'm going to lubricate the tip of my catheter. Okay, the tip of my catheter is lubricated. I'm going to place it back inside the container. I'm going to take my syringe. I'm going to go ahead and lock it in. And I'm going to place it in the container. This time I'll take the plastic top, set it up, making sure that I keep my body facing the sterile field and I'm working inside of the 1-inch borders because I'm currently sterile. Drop that, and at this time I will move this out of the way, and I'm ready to begin my catheter insertion. So I'll take a cotton swab. I will go with the labia majora, come around and drop. I will do the other labia majora, come around and drop. Labia minora, come around and drop. Labia minora, come around and drop. And going from clitoris to anus, down the middle, coming around and drop. And once again, clitoris to anus, coming around and drop. So at this time, my cotton swabs have been used. I'm going to pick this up and making sure that I keep my body facing my current sterile field, I'm going to drop that out of the way, no longer needed. And we are ready for catheter insertion. So I'm going to tell Mrs. Knight at this time, I'm going to bear down, about to insert the catheter. I'm going to take my left hand and I'm going to contaminate it by touching the labia. At this point I can adjust my drape as needed. I will spread the labia and I will tell her, alright Miss Knight, go ahead and bear down. I'm going to insert the catheter and feel some pressure. And I will begin catheter insertion, making sure that the catheter does not touch any skin on the way in to keep it sterile. Making sure that my right hand does not touch any skin to keep it sterile. Continue to insert it. Okay, I see urine, so I'm going to go about another inch. And I have gone about another inch, so I'm going to take my left hand here, and pinch off the catheter, not pinch it off, but I'm going to grab it. Take my still sterile right hand, and I'm going to blow up the balloon. Take that off. This is ready to go. And at this time my sterile procedure is finished. The catheter is inserted. The balloon has been blown up. I can attach it securely to the leg here, dangle it off the side of the bed, and if I needed to collect a specimen, I have my specimen container. I will, at this point, tear my drape off, collect this drape, put it in the trash, and I'm no longer sterile, but the procedure is over. Say, alright Mrs. Knight, thank you. Over the legs, over that. Bed rail up, and the catheter has been inserted.